Hello, everyone, and welcome to today's webinar, New Frontiers in Fluorescence Guided Endocrine Surgery.
The American Thyroid Association published view of the most common complications and how to prevent them after total thyroidectomy. Transient hypocalcemia in America is up to 38%, and this is really very high. Why this is happening is because the parathyroid glands, they have a really very small size. They are invariable in positions, so we cannot determine exactly what they're going to be during a dissection. But now we have two different types of methods. One, that we are not going to use a dye, this autofluorescent, and we can use a dye in the signing to evaluate if the glands are perfused or not. We analyze the density ratio of the different glands, and what we found there is that the parathyroid glands glow more in comparison to the thyroid glands and also to the background. Then we analyze the number of glands that we can see when we visualize the glands with the white light. We found it an in average 2.5 parathyroid glands. And when we use the different equipments, the number of the glands that were identified were 3.7, and this was statistically significant. There is a huge difference in between the fluorescence of the parathyroid glands and the rest of the tissues. This was described by the group of Aaron Burr in Cleveland Clinic, Ohio, and they put together 39 total thyroidectomies and 5 lobectomy. They analyzed the detection rate of the parathyroid glands. Very interestingly, the detection rate of parathyroid glands was really very similar with both technique, 95 or so 98%, and this was not statistically significant. And if you look at the rate of hypocalcemia using indocyanine in green, the hypocalcemia rate was lower. So really very interesting paper that was published in January this year. And when using the equipment, the rate of parathyroid glands that were identified was higher, and also the inadvertent resection was really low. Rate of hypocalcemia when they used the equipment with autofluorescence dropped from 20% to 5%, while the group that did not use hypocalcemia stayed the same. The group of Fortunito analyzed the identification of the parathyroid glands with indocyanine in green, and they scored the different parathyroid glands according to the perfusion. So at least when one gland was white or well perfused, just only 2 transient hypocalcemia, and when the score was 0 or 1, the transient hypocalcemia was higher. They found it 11 patients and 2 that require calcium supplementation, and permanent hypocalcemia in 2 patients. I believe that there is a place for near-infrared guided surgery for endocrine procedures. There is enough evidence that supports the use of autofluorescence for early identification and increase of visualization of parathyroid glands, and that parathyroid gland perfusion evaluation with indocyanine green has demonstrated to be useful to consider reimplantation of parathyroid glands and can be a complement as a predictor of hypocalcemia. Thank you very much.